This next case is of a simultaneous endovascular management of a posterior communicating artery aneurysm and an internal carotid artery stenosis. Here we have a 70-year-old female with an incidentally found left posterior communicating artery aneurysm. This patient was going to be managed with endovascular therapy. Further workup showed she had left internal carotid artery stenosis, which was significant. She has a history of subarachnoid hemorrhage in the family. As you can see from this non-invasive imaging, we have the posterior communicating artery aneurysm as delineated by the red arrows. And again, here you can see the start of the angiogram. We're going to obtain left common carotid artery access. Here you can see the envoy being advanced over a VTEC catheter, and you can see a critical stenosis in the common carotid artery, which will be repaired with carotid artery stenting. Here you can see the filter being brought into play. We advance the filter through the lesion and deploy the filter in a safe landing zone in a relatively straight segment. Following that, we bring up a carotid stent, and here we can unsheath the stent again into normal vessel, spanning the stenosis, and again ending the stent in normal vessel. We carefully unsheath the stent, being mindful that our guide does not collapse. There is a slight waste in the stent where the calcium creating the stenosis is. At this point, we're going to retrieve the filter. We're not going to worry about balloon inflation, and we're going to tolerate some of the residual stenosis. We bring our guide through the stent, bring our capture catheter up, and capture the filter. Now we have excellent distal positioning of our guiding catheter across the stenosis, which is safe, and now we can turn our attention to treating the posterior communicating artery aneurysm in a patient who has multiple aneurysms and a family history of subarachnoid hemorrhage. Once we navigate our wire past the aneurysm, we bring our microcatheter into a safe zone, in this case beyond the ICA bifurcation. And here you can see we are deploying a flow diversion device, specifically a pipeline device. We patiently wait for the distal portion of the stent to open, and once that begins to open, we can continue to deploy more of the device. You can see that the distal portion of the stent is not quite opened yet, so therefore we'll have to manipulate that stent to help it open in an expeditious fashion. Again, we see the distal portion of the stent is not yet open, but we will address that through careful bumping and pulling of the stent. Here you can see the stent open just by tugging on the introducer wire of the apparatus, and that was just enough to help the stent open up. We are well across the aneurysm neck at this point. We're pleased with the deployment of the flow diverter. And this brings this case to conclusion.